Okay, folks, we are going to go ahead and get started. Again, I'd like to welcome all of you to today's webcast, Understanding and Approaching Individuals with Disabilities. My name is Dr. Mary Hauser, and I serve as an educational consultant for the American College of Financial Services. I'm also an associate professor of special education at Westchester University of Pennsylvania, which is one of our state universities here in PA. I've been a university professor for about the last 15 years. And when I was younger, I worked as a high school special education teacher. But of particular importance to today's webcast, I am a parent, an aunt, and a child of someone with a disability. So that will play an important role in the things that I'm going to talk to you about today. So we have kind of a full agenda for the next hour. Again, we're going to be looking at individuals and families with disabilities. So we really want to start by defining what we consider family to be. So we're going to look at the definition. We're going to look at the different types of families that currently exist. And then we're going to define disability and look at the types of disabilities that exist. So it's important that you have a clear understanding, not just of who makes up the family, but all of the different types of disabilities that exist today. Then we're going to move on to parenting a child with a disability, and we're going to talk a little bit about siblings as well. And then I'm going to take you through some important issues related to development as a child with a disability matures. And then we're going to bring it all together, and I'm going to provide you with some tips for financial planning with individuals when working with individuals with disabilities. All right, so let's begin with the definition of family. One of the most important things to know about this is that this definition can really vary from person to person, but essentially we're talking about a social group made up of parents and their children. Okay, that's really who we're looking at. But as you can see, it's also a group of people who come from the same ancestor. For example, you resemble your mother's side of the family, or a group of people living together as in a household, or a group of things sharing certain characteristics, a family of languages, for example. But we're really looking primarily at 1 and 2 as well today. So it's important that we look at the 8 different types of families. And it's going to be relevant for all of you to understand that you could be working with any one of these different types of families. So let's spend a few minutes and go through each of these. First, there's what we call the traditional nuclear family. And in this family, you have a mom and a dad and children. Okay, this is traditional. In an unmarried opposite sex family, you have a man and a woman, of course, who are not married, and they exist as a family. You could have an extended family, in which case you might be talking about grandparents or cousins or aunts and uncles. A single parent family where there is just a mother or a father. You could be working with a blended or step family where families with children come from outside relationships. An adopted family where children are not their biological children. A foster family where is a family that provides usually guardianship or custody for a child. And then you could have same-sex parented families where you have 2 females parenting or 2 males parenting. So there really are certainly a lot of different combinations, different types of families out there that you need to be familiar with. And any one of these types of families could come in to see you for financial help. Now let's move on to the definition of a disability. And again, just like with family, there are some different definitions, but this seems to be the most widely accepted, I would say. So a disability is an inability or an incapacity to perform a task or an activity in a normative fashion or in a typical fashion. So whenever this occurs, whenever someone is not able to perform a task or an activity in a typical way, we consider that individual to have some type of disability. I want to spend time today talking to you about the different types of disabilities. And I usually do this in my presentations because I want you all to understand that there is a very wide range of disabilities out there. And I think personally that the school system, our public school system in the US, does a really nice job in terms of categorizing students so that you can understand the different disabilities that are out there. So we're going to go through the different types of disabilities, um, and we're going to start with autism. So autism is probably the fastest growing developmental disability that we have today. As of 2020, 1 in 54 individuals is being diagnosed on the autism spectrum. And these folks have problems with social skills, communication, repetitive or restricted behaviors. Developmental delay refers to younger people up until about the age of 8 or 9 who show problems in development in different areas of development who have not yet really been classified yet with a particular disability, but are receiving services in schools for their delays. Intellectual disability are folks who have a problem in two different areas, and both of these areas have to be met. They have lower IQ, which means typically 70 and below IQ, which is what we call 2 standard deviations below the norm. And they also have problems with adaptive behavior, which is daily living skills. So intellectual disability is fairly common. It's a developmental disability as well. Speech or language issues. Folks can have anything from an expressive language disorder to a receptive language disorder or both. So that means they have problems both speaking and being understood, or they might have some kind of speech issue, such as a fluency disorder or stuttering or something like that. Individuals can be deaf, which I know you're familiar with, and they can be blind. And sometimes we combined those in schools, we combined those. So let's move on to the next group. You might work with people who are blind, visually impaired. You might work with individuals who have some kind of emotional disturbance. That could be anything from obsessive compulsive disorder to anxiety to depression. Um, there are many different types of emotional disturbances. Multiple disabilities are individuals who have one or more of the types of disabilities, more than one of the types of disabilities that we're talking about. Learning disabilities, that's an academic problem where individuals have normal or above normal intelligence, but they have problems processing information that's coming into them. Traumatic brain injury, you might know someone who has been in a car accident or a skateboarding accident, and they've had some kind of blow to the head, and it has, caused damage to the brain. And typically, we refer to those as either an open head injury or a closed head injury, but this can result in problems as well. We just talked about traumatic brain injury. Orthopedic impairment, individuals who have cerebral palsy or muscular dystrophy have an orthopedic impairment. Hearing impairment, I know you're familiar with what that means, and that would go along with the deafness up above. And then there's something that we refer to, if you are in schools, as other health impairment. And that's kind of a catch-all category For people who have attention deficit disorder, they might have asthma, they might have diabetes, they could have AIDS, and a number of things. So there are many, many, many different types of disabilities out there today. So I want to start by talking to you and kind of setting the mood for parenting a child with special needs, because by and large, these are the folks that you're going to be working with, I would imagine. And so, in order to kind of get you thinking in the way that I want you to think and in the way parents think, I want to show you a very short video clip on what it's like to parent a child with special needs. So, let's take a look.
You're at a grocery store or something and they see this kid throwing a temper tantrum, they just think, oh, these are bad parents. And I just wish they knew the struggle that we went through. Like, they have no idea what we go through. We didn't know about Zach or his condition or anything about him until the day he was born.
Zach was born with a rare syndrome called TAR syndrome. He was diagnosed with Down syndrome at birth. It was one of those things where the doctor kind of gives you a choice whether you want to keep the baby or not. And I was absolutely devastated because I thought that was like the most horrific thing you could ever tell a mother in third trimester.
Our son Jacob has autism. I could not say the word autism for a couple of years, actually. It was really hard for me to accept that diagnosis.
I can vividly remember him laying on the table, looking at his little short arm. That day was the hardest day that I'll ever go through.
The second that Zach was born, we were researching everything that we could possibly find. We had this baby boy that we had no idea what to do with at the time. You know, how to give him a bath. Little things that any parent would go through with a newborn. We had to rethink every single one of them. In the beginning, you don't know anything. How long is it going to take him to talk? How long is it going to take him to walk? How long is it going to take him to be able to use the bathroom independently? All of those things, you just go one day at a time.
I always tell people, like, until you're directly involved in it, you don't really get it.
At first, I was just like, why did this happen to me? You know, but now I look at him, he's just an awesome kid.
Kinyari is absolutely resilient. We knew that from birth that he was going to have open heart surgery. You would never even think for 1 second that this is the same kid that either is about to go through surgery or just came out of surgery. Because he's always happy and generally in a good mood, he puts me in check. There were so many things that we cried about, things that he would never, ever be able to do. And starting at about a month old, Zach was just checking those things off the list. They made his first set of prosthetics just for standing. We practically broke those things because he was trying to walk all over the place.
A couple of years ago, he was able to teach him to ride a bike.
At first, Jacob didn't like riding the bike. He was kind of out of control. He didn't know what he was doing. A couple days later, he came up to me and he said, "Dad, bike." And man, that was just awesome. We took the training wheels off. He's riding a bike with a special needs kid. A lot of people think, oh, he can't do it. You can't just say, oh, no, he can't do it. Get him out there and try. If you're raising a kid with special needs, don't dwell on the stuff that you don't think they can do, because they're going to write their own book.
Now, instead of saying, why did I get a special needs kid? The question is, how did we get so lucky?
Everyone always says, oh, Zach's so blessed to have you guys as parents, and completely opposite. We're blessed to have Zach. My advice to parents going through the same thing that we are, try to be patient. Try not to treat your kid differently.
Always have the highest expectations for your child. Be proud of the kids that you have. For whatever reason, they were gifted to you, and to just, really appreciate that gift and see the positive in it at all times.
The advice I would give would be just keep your faith that you can do it. We all have challenges as human beings, but being a mother has been the best reward I've ever received. I'm just grateful to have my kid as is. He's amazing.
Okay, so I'm hoping that this video clip has gotten you thinking a little bit about parenting a child with a disability, or what it's like. I do want to emphasize the point that a lot of times we spend more time talking about the negative aspects, just to bring awareness of some of the issues that can come up with parenting a child with a disability. But I really don't want you to lose sight of there are many, many benefits of parenting a child with a disability as well. The things that I'm going to bring to you today are more of the troubling things, and I do that so that you are prepared when these folks come to see you for your guidance and counsel, so that you know what is happening in their lives. But I always, mention this as a caveat because I want you to know that it can be a really wonderful thing as well. Okay, so having said that, let's talk a little bit about parenting a child with a disability. So, when you're a parent of a child with a disability, you're going to spend a significant amount of time and energy parenting. And depending on what the disability is and how demanding it is, because some are more demanding than others, it's really going to it really can take a lot out of you as a parent. And that can lead to having less, as we say, to give to other family members because your time and effort tends to go to the individual that needs it the most. And that a lot of times is the child or person in your family with a disability. As a result, this can lead to increased stress in the family. Also, what is important to know is that parents can end up paying out money to care for their child, depending what the disability is. And some individuals do not have health insurance, as you well know, and this can cause enormous stress. So let me give you an example, a personal example that is no longer the case for me, but still is for some parents. So I have a young adult with autism, and back when he was going through school, there was a therapy, and there still is a therapy called applied behavior analysis, and it's a very expensive therapy, and yet it is the preferred therapy of choice. And so I was fortunate enough in my profession to know that this was something that my child needed, and he was going to have it one way or the other because at the time the school system did not provide it. So I knew enough to take the legal action to get my child the education that he needed. However, there were parents at that time who did not know that, did not know how to go about getting their child what they needed. And in fact, today, I will say that although this service is offered in schools, sometimes parents want more of it and they can't pay for it because they might not have health insurance, or insurance might not cover it in the state that they live. So there's all kinds of stressors that can come into play. So I just want to make you aware of that. Parents of individuals with disabilities have to balance all of those things that you folks do if you don't have children with disabilities. There's work and there's life and there's childcare. But on top of that, parents also oftentimes will have to do additional things with their kids, such as therapies outside of school, or if their child has a medical issue, he or she might have to go see certain specialists. And again, the demands of having a child with a disability can be great. Another thing that is problematic to parents of individuals with disabilities, and this is really a big thing, is that they can experience isolation, social isolation, if they cannot find a group of people who are understanding of their child with a disability. And so let me give you an example of that. If your child is one that has behavioral issues, and every time you take that child out into public, he has a tantrum and he throws himself or she throws herself down on the ground, you might get to a point, if you cannot begin to target this behavior to minimize or reduce it, that you can't bring that child out into public, or you can't bring that child over to your friend's house. And so what happens is that to some parents, it becomes such a big deal just to go out to the grocery store with their child, to their friend's house, that they don't do it. And as a result, they experience quite a bit of social isolation. Also, in terms of marriage, we know that marriages of individuals with disabilities can be under a great amount of stress. So you probably know that statistically, about 50% of couples eventually divorce. When you look at parents of individuals with disabilities, we are looking at an 80% divorce rate. So the chance of that happening is really significant. And research has told us that it's because of all of these types of things that I'm telling you about in today's webinar. So it can be a very rewarding job, but it can also be a very stressful job as well. Now let's spend just a couple of minutes looking at siblings, because siblings, if the family has siblings, play a really important role. And this is particularly true because siblings provide to that individual with a disability a lot of modeling of appropriate behavior with respect to language and play. A lot of times siblings will take on a teacher role and become that brother or sister's teacher. They also are considered many times that child's first friend. And something that will be of interest to all of you is that oftentimes, again, siblings will become the caretakers of that brother or sister with a disability once the parents pass on. Now, some parents will say, I don't want that for my typical child, and other parents will expect that their other siblings will do that job. It just depends on the family. So there are some issues that are really specifically related to development, in a child's development with a disability, as it relates to parents, that I want to share with you, so that when you are working with families and the parent says to you, oh, we have a 5-year-old with cerebral palsy, you'll know some of the issues that they might be experiencing. Or if they say, oh, my son is getting ready to finish school, he's 21 years old, and we're really nervous about what life is going to hold for him, and what's going to happen when he leaves school or when he graduates. So we're going to briefly look at some of these different issues that are related to development. Beginning at birth and through the age of 5, these are the common parent concerns that will be happening. The first one is discovering the fact that the child has some kind of exceptionality and coming to terms with that. Some parents will know when the child is in utero if there is a developmental problems. For example, if the child has Down syndrome, a lot of times parents will know that there's a chromosomal issue going on. They'll have testing done and they'll know. Other times parents will know at birth. Maybe something happened during the birth process. For example, maybe the child did not get the amount of oxygen that he or she needed, and that caused some kind of disability. And yet some parents will know in the first few years of life. Some disabilities are fairly easy to obtain an accurate diagnosis. Other disabilities are not as easy, and it really depends on what we're looking at. For example, if you have a child who is born with, we'll use Down syndrome, for example, at birth by looking at some of the physical characteristics of the child, in addition to the chromosomal testing, that child has a disability. But there are other disabilities like autism, for example, that don't have a blood test that you can do to determine if there is an issue going on. and it's a very extensive workup to figure out if that's the disability. Then parents have to inform brothers and sisters and relatives that a disability is there. And depending on who your family is going to depend on what that reaction is going to be. Some families are very, very accepting of a difference, but there are also families who will deny that there's anything wrong with a child. And that can be very impactful on the parents, because if the parents know that there is an issue with a child and they have a grandparent that says, he's going to grow out of it, there's nothing wrong with so and so, well, then that's really a hard thing for that parent or those parents to have to contend with. And yet another issue is obtaining what we call early intervention services. And these are academic and developmental services that try to bring the child up to speed, up to where he or she needs to be before they go into the school system. So all of these things are going on in the family from birth to about the age of 5. As the child gets older, and we're talking, during the primary years of school, sometime between the ages of 6 and 12, things begin to shift a little bit. And parents' concerns are that they are now beginning to really adjust to the diagnosis of the child and what his or her schooling might look like. So they're beginning to really take it all in and begin to understand what is involved. They might be arranging for specialized extracurricular activities for their child because he might or she might not be able to do all the same things that other boys and girls are able to do. They might spend time locating community resources for their child where they can be more involved in their community. And they begin to develop a vision for their child's future. So at this point, they really start thinking about, what is my child's life going to look like 10 years down the line, 15 years down the line, and so on. So primary years, ages about 6 to about 12. The secondary years are a particularly challenging time. We're talking about children, I say, between 13 and 18. But for our folks with disabilities, we really extend that until 21. And so at this point, families are what we say adjusting to the chronicity of the exceptionality. And when I say chronicity, I mean the long-term effects of the exceptionality. And they begin to realize that, this disability, most disabilities are going to be there for the child's entire life. And it really begins to hit them in the secondary years because they're realizing now that their child with a disability is emerging and growing into becoming an adult with a disability. And there's certain things that they have to consider. One of those things is issues related to emerging sexuality, because just because you have a disability does not mean that you don't have your own sexuality and all of those developmental things that go along with sexuality. The individual with a disability will experience those too. There's also planning for career and vocational development. So the question is, my child is now we're starting to think about him going out into the world. And will he or she be able to get a job? And if they do, what is that going to look like? What kind of job or career could they have? And then also there is always that social piece when we look at the secondary years. And this is true for any child. We have to address possible peer isolation and rejection. And unfortunately, individuals with disabilities experience this a whole lot more than even your typical teenagers do. And so as parents, we really look at that and our heart breaks just like it would for our typical kids. but we oftentimes really spend time proactively seeking out opportunities, social opportunities for our kids with disabilities. So that is yet another something that we work on. Okay, now that the child is out of school, so this is, it depends. If your child is able to graduate at 18, then he will go on obviously into what we consider post-school family considerations. But if your child is in school till he's 21, then this usually starts around their 22nd year. But whatever the case, when an individual turns 18, whether he or she has a disability or not, they are legally considered an adult. So that adult might still be in school because he's entitled or she's entitled to be there until the end of their 21st year. They're still technically an adult. So then all sorts of things come up. And this is huge because all of those years that individual has spent in school, being offered services and being eligible for them. And now that individual has to be, being entitled to them rather. By law, the children with disabilities who qualify are entitled to a whole plethora of really great things. When they finish school or they graduate from school, now all of a sudden they have to be eligible for them. And here is a list of considerations. Will the child be able to be independent, or will he or she need a guardian? If the child needs a guardian to help them make life and financial decisions, who's going to be that person for them? And then there comes the question of, will they qualify for Social Security income? There's the concept of developing a special needs trust for the family. We'll go back here for a moment to, where will they work? Will it be competitive wage, or will they work in some kind of sheltered environment? Will they be able to go to college? Or will they have to go to some kind of day program with other individuals with disabilities? Can they live on their own, or does that also need to be supported? And to what degree can they be involved in their community? So I would imagine, and I could be completely wrong, but I would imagine for those of you that work with families with individuals with disabilities, this time right here when they transition from school into the real world is an area of particular concern for the parents. All right, so let's talk about some tips for financial planning. And I really want to talk about each one of these with you and kind of help you think about the best course of action for working with families. Now, I've been told through the grapevine that a lot of you are parents of individuals with disabilities yourself. So you are already very informed people and know a lot about what I'm going to say. These tips are from a parental point of view, a parental point of view, not from a financial point of view. So when I talk to you about these tips, I'm speaking to you as a parent of a child with a disability, as if I were walking into your office and seeking your help regarding whatever it is financially that I come to see you about. These have also been researched heavily as well, but I found these to be the best tips. So let's take a look at each one of these. Tip number 1 says, build a relationship with families that demonstrates your understanding of their special circumstances living with an individual with a disability. So relationships are super important anyway, and I know all of you know that. When you want to really make good progress in the business world, or for me in the academic world, I know that building that relationship is what's going to get me further. When you're working with parents and families of individuals with disabilities, it really helps for you to demonstrate that you, as the person that they're coming to see for help, understands their special circumstances. So the more you know and the more you demonstrate an understanding, the better. The further you're going to get with the family. So that's my tip number one. Tip number two says, if you don't understand something about the child's family or the child himself, do not be afraid to ask them. And when I say that, I mean ask them directly. It is much better if, when you are speaking to the family, that you come right out and say, I really don't know much about this, or can you tell me a little bit more about how X, Y, and Z is affecting your family? It's much better to do that than to act like you know something that you don't, because acting like you know something that you don't will be very obvious to the family of the individual with a disability. Okay, they're going to be able to call you on that. They're going to get it if you are not being forthright about your knowledge. So just be very honest with them. That's really going to get you the farthest. Tip number three, do some research. And when I say research, I don't mean spend hours and hours reading up on things, but do some research on the child or the adult child's disability so that you can be knowledgeable when talking to parents. So if you know that you have a family coming in or a parents coming in of a child with a disability, and that child has some kind of severe emotional or behavioral problem, spend a few minutes looking over, even if it's a simple Google search, finding out what that disability is all about, so that when they sit and talk to you about their concerns for maybe financial planning for that child, it all will make sense to you from a very general perspective. You'll also be able to speak to them more intelligently. And again, I'm not suggesting that you write a dissertation or read on and on and on about it, but present yourself in such a way that you have cared enough to do your research to know about the family. I guess that's better said. Number four, this is something that I was always taught, and I think is important for anybody, is to take the time to understand how the family's cultural background may impact the financial decisions that they're making. And so when I say cultural background, I mean this in a very broad sense. You really have to think about, a number of things, not only the fact that they have a disability they're in the family, but also, where is this family coming from? What are their, what do they spend money on? What are their thoughts on saving? All of this is going to come into play when you meet with them to discuss whatever it is that they're seeking help from you for. So take time to know and understand their culture. Tip number five of all of the tips, I would have to say is probably, to me, the most important. And that is, listen to parents' expectations, concerns, and fears about planning for their child with a disability's future. So I'm going to tell you in a very honest way that most parents who will be coming to see you, who have children with a disability, have a lot of concern about their families and their child's financial future. It is very unknown for them. It's not as easy for them to predict what their child's life will be like when they're no longer here. And they really want to know that you are listening to what they're saying and that you're taking it all in. So I always say, in situations like this, it's a lot better for you to listen in the beginning than it is for you to talk. Listen to what they're saying to you. Tip number six, Link the parents to the appropriate person or organization who can answer questions about Social Security, special needs trust, independent living supports, guardianship. If you're not that person, and I know that there are a wide variety of professions out there that I'm speaking to today, if you can't speak smartly to something, then be that liaison, be that person to refer out. Say, I can't answer that question for you. It's an important one, but I know somebody who can. So let me give you their email address, or let me give you their phone number so that we can get you the right information to help you, in the process. And then last, um, help parents to complete any paperwork to apply for supports through state and government agencies. Now, again, I don't know what your role is, and I don't know if this is something that you would necessarily do in your job. However, if it is, I will tell you that the paperwork that comes to parents and families with disabilities in terms of getting support is enormous. I mean, it can be a nightmare, and it is very overwhelming to families to kind of decipher all of this stuff that they've never had any experience with. So any help that you can provide them to complete paperwork for supports through the state or federal government is going to be wonderful. They're going to love you for it. And so those were my 7 tips. And I hope that you are able to take away something from that. So now is a good time for me to start taking questions from you. So what I'm going to do is I'm going to go into the Q&A, and I'm going to see if there is anything that I can answer. So I'm going to take this down so that I can see it. So give me just a second. Okay, so it does look like we have some questions. Let me start at the top. I hope you all can see me. Will you be provided these slides? I can provide the slides. I do know that the college does post the recording, but I can provide the slides too. I'm not quite sure yet who I would provide them to so that they could be posted, but I'd be happy to do that. All right, let's see what else. Are slides available? Okay. Is paraplegia considered a disability? So paraplegia is part of a group of disabilities, and yes, it would be considered a disability. Yeah, it falls within a disability category. Jeff, I have questions regarding the 80% divorce rate of families with special needs. I was shocked by that number and did some searching. Most sites and information I found showed that while likely higher than the general number, it was not that high. Well, I do have some research on that, Jeff, and I can provide it to you if you would like. It is very, very high. It is particularly high in the area of autism spectrum disorders. So I can provide that. If you would like that, just let me know. Just type that, maybe type your name and address, email address in the chat, and I can take a look at that. Humberto, can you speak to supported decision-making? So I'm not exactly sure what you're referring to when you say supported decision-making. Are you talking about guardianship, perhaps? Is there a way for me to find out, Humberto, if that's what you mean, when the guardian works with the individual to help them make these decisions? I'm not sure. I'm not sure about that question. But if you send me an email, and my address should be posted on the last slide, which I can bring up, then we can go ahead and we can have a conversation about that. Okay. How do you handle when they want to bring the child? I always try to meet with them, but this can make a very hard meeting. No doubt. I mean, it is hard. So first I would just ask them if I would explain to them, it's hard. Let me start by saying it's hard. I would ask them if they do bring the child, if there's somebody who could sit with the child, maybe out in the waiting area. So if there's another sibling or someone who could watch the child, I would try to work it that way. I would discourage them from bringing the child into the meeting itself for obvious reasons, or it depends on if you know the family or not. If you don't know them, that would be probably what I would do. Say, you're welcome to bring your child. However, I would recommend that he or she stays out in the waiting area so that, we can get through the information that we need. I think most parents will understand that. And if they say no, that we can't do that, then I don't know what to tell you, honestly, because some parents will insist on it. But hopefully they'll understand if you put it to them nicely. I hope. Okay. Douglas, hello. Question on terminology. You learned in class that a child with special needs, yes, is preferable to a special needs child. Here you use child with a disability. Not being critical, just wondering what your thinking is. Okay, so we do like to use person first language, and that's what you're referring to. So here's the thing. You could say a child with special needs. You could say a child with a disability. You could say a child with an exceptionality. So it doesn't really matter. That's the honest answer. But it does matter to put the child or the individual first. There are some disability categories that don't like it when you do that. For instance, I know that the deaf community and part of the autistic community would prefer that you call them by their disability. But I train classroom teachers of kids with disabilities, and we always train them person first language. So there you go. Okay. I mentioned traumatic brain injuries. Concussions come to mind. What do you see as the long-term disabilities with these events if there are multiple events? Wow. So that's a medical question, and I don't really want to touch that. I can tell you that I have worked with students, high schoolers with traumatic brain injury, and one of the kids that I worked with was the quarterback for the high school football team, and he had some pretty serious damage due to repeated concussions. But that's more of a medical question, and I don't really want to. Unfortunately, I don't want to touch that one. I'm sorry, I can't help you. Resources for RET. I hope I am spelling this correctly. I don't know what RET is. RET. I bet I have a resource for it if I knew what it was that you're talking about. So again, I'm happy to provide you with any of this. If you want to go ahead and send me an email, I'll bring back up the slide presentation. Okay, thank you for your compliment. I like that. That's always nice to hear. Are we as a society starting to get away from the term disability to something less dissing? Well, we have in some ways. I mean, I will say, for example, in recent years, to the better, we have changed one disability category, mental retardation, to intellectual disabilities, because that is considered to be less stigmatizing. But are we really there yet? No. I mean, and then the question is, well, what could we say that would still describe the situation, but not be derogatory? So that would take some thought. And it depends who you're talking to. You speak to people who work with individuals with disabilities. We use the term disability, and I use it every day, and I don't look at it as a negative term. So I don't know if that answers your question, but I don't know. I don't know that we're getting away from that at all. Okay. How would a family member start looking for group homes if independent living isn't possible? So that's a great question. Group homes, where this is a whole nother presentation almost. And I talked a few months ago about the whole concept of we're kind of getting away from group homes because of laws and because we're getting away from the concept of institutionalization and a certain number of individuals with disabilities living together. So to answer your question, if there are some available, I would say that you would probably look to your state or local associations that could help you. For example, the ARC, which some of you might have heard of, could give you information on group homes, and that's an old term, the Association of, I think it is, of Retarded Citizens. Of course, we don't use that term, like I said, anymore, but they sometimes have it. So you want to look for local organizations that deal with individuals or work with individuals with disabilities. And then there's also some local government agencies that might be able to help you with that. Okay, does seizure fall under disabilities? So yes, seizure disorder or epilepsy is considered a disability, yes. Okay, so getting back to the supported decision-making is a less restrictive alternative to guardianship that's gaining popularity in many states. Yes, I would imagine that, okay, so I think I know what you're speaking of now. So the individual is still making his or her own decision, but they're receiving counsel and the guardian is not taking full responsibility. I believe that's what you're speaking of now. Yes, some individuals are able to do very well with that type of situation. Other individuals or adults with disabilities are absolutely not able to. For example, if you have somebody who is nonverbal, meaning they don't talk, or they just don't have the intellectual capacity to make decisions, then a supported decision-making situation would not be appropriate. But again, there are kids who are, who need minimal support, who grow up to be adults who are going to be just fine, but really need people to help make important life decisions with them. So that might be a better alternative. It just depends on the individual person. Okay, Sam, this presentation does reflect my experience as a parent of a child with autism. You are hoping to learn more information about special needs trust. Right, so this particular course does not get, this particular presentation does not get into that. My expertise is in the area of disability, not in the financial aspect of it so much, except for to give you tips. So I can give you some names, Sam, of some people that you could talk to get that information, and I would be happy to do that at the college. But that is not my area of expertise. Guardianship challenges if no real guardian to accept the responsibility. Yeah. So I was part of a situation like this fairly recently. There was an individual who lived with his father until his father was very old, and the adult child had a disability, and no one in the family wanted to take guardianship. So they sought outside individuals to do that who were qualified. For example, a fellow colleague of mine who worked as a special education professor took that position as the child's guardian. And it ended up being a paid position for him because no one in the family wanted to do that. So, okay. All right, so we're getting now down to just another question or two. I see in divorce rate questions, so I'd be happy to do that. How does a divorced couple deal with assigning guardianship? I don't know. That is a legal question. Oh, Rett syndrome, Andrew. Okay, Rett syndrome, yes. Let me get your email address from you. I've really enjoyed speaking to all of you today, and I wish we had some more time, but this is where we're going to have to end for the day. So thank you very much. I really do appreciate it.